Good afternoon, everyone. I'm Amanda Slater from the Utah Department of Health and Human Services. I'm an Assistant Deputy Director here. Thank you all for joining us today. Wanted to just kind of give a couple quick housekeeping reminders for those of you who may be new to this call or it feels like it's been a long time since we've been together. Our closed captioning is available by clicking on the live transcript spot at the bottom of the bar if you need that. The meeting will be recorded for all that are not able to attend and be sent out. Additionally, at any time during the meeting, feel free to answer or enter any of your questions in the Zoom chat, and we will try to answer them as best as we can. If we're unable to answer them today, we will get back to you as soon as we can with those answers. Additionally, just wanted to remind you, you can also at any time email questions to our main email address, which Joe will or someone will drop in the chat here at any time during this meeting, before the meeting, or after the meeting. We'll get back to you as soon as possible. So I will go ahead, and I don't have any updates from me today, so I'm just going to start kicking it off to our OU directors. So I will kick it to you first, Shannon.
Great, thanks, Amanda. Hello to everyone, and again, thank you all for our patience as we work through our merger and our process improvement, and continuing to work to improve our service for you all. We wanted to let you know that, as we talked about previously, that Kim Ontiveros had moved to another position within the department. Emma Anderson has been hired into that position. Her email and contact information is in our org chart, which is available on our webpage, which we will drop into the chat for you all. Additionally, we unfortunately have announced that Amanda Marin has also moved to a different position within the department. And while we are, of course, very pleased that she is continuing her professional growth, we will miss her. We are currently in the process of filling that vacant position, and we will let you know the individual who has filled it when they are hired. And again, we'll update the org chart, so you will always have name and email contact for any of our staff. We wanted to let you know that the pre-solicitation meeting will be moving online by July 1 of this year. More information will follow, just so you are aware as our community of providers that this change is happening. Moving forward, and again, this is for mainly for new providers, but we again want to make sure that you all are aware we make these changes. When you attend a pre-solicitation meeting and you decide to step forward and move through contracting with the department, we have now started that all that documentation that has to be submitted to show that you're ready to enter into a contract with us must be submitted within 6 months of attending a pre-solicitation meeting. If that doesn't happen, then the provider will need to attend the pre-solicitation again. One of the reasons we're doing this is that because we are continually updating and fine-tuning our material, there can be changes if too much time has passed, and we want to make sure that as providers come in, that they are prepared as possible with the most up-to-date information to be successful. We also want to let you know that we have posted the settings monitoring checklists on our website so that you can go and look at exactly what we will be looking at when we come to do monitoring as far as settings compliance is concerned. We want you guys to be able to have that information up front so you can know what we're looking for, you can be prepared. Please feel free to download it in preparation for our site visits. I also want to let you know that we are in the process of posting documentation templates on our website. Providers should feel free to use these templates as a starting point. for creating your individualized provider documentation. Again, this is often mainly used by new providers coming in, but I know sometimes when something hasn't been updated in some time and we're having TA technical assistance discussions, there has been a desire to really have some guidance as you work to incorporate changes into your documentation. Please, again, feel free to use this as a starting point, but you are not required to use these templates. We just want to be able to provide as many tools as possible to support success. I believe that that is all of our updates, unless Carrie has any updates that we've missed here. Just go ahead and hop in if you need to do that, Carrie. Otherwise, if anybody has any questions, I will check on the question page throughout the meeting and ensure that we work as best to get those answered here in the meeting. And if not, as Amanda said, we will follow up as well. Thank you.
Thank you, Shannon. We will go ahead and turn it over to Sherry.
Well, hello, Sherry Brummer here. Nice to see all of you, even if only virtually today. A couple announcements that we have got, and that we have got a new position that we have filled. So for those of you that worked with Leslie Lundberg on any sort of contracting issues related to sort of the ongoing piece, kind of that clinical piece, and that sort of thing, we actually have a new person that I would like to introduce today, as well as someone else who is supervising her, and they'll together with me kind of be tag teaming. So let me introduce first Kyla Clark. Kyla, are you on? Not sure if I'm seeing her.
Sherry, I didn't know she needed to be promoted, so she's gonna be able to talk in about 1 second here.
No worries at all. Not a big deal.
She's in now.
I should have let you know that. I apologize for that.
There she is.
All right. Hi,
It was
Kyla.
a virtual promotion to go along with my real life promotion. That was exciting.
So Kyla, if you would just like to introduce yourself and just a little bit about what you'll be doing for DCFS, and then I will introduce Kevin as well.
All right. So my name is Kyla Clark. I have been at the state office for about 10 years for DCFS already. I have been over in-home for most of that time. I'm excited to get to be over our service continuum. So a lot of the roles that Leslie Lundberg was in before, as well as supervising my previous position, and the TAL, post-adopt, and FAM teams will be under my team moving forward. So I'm excited to be at more of these provider events.
And we are so excited to have Kyla in this position. She is such a go-getter. And I mean, anything that you need done, Kyla has not already done it and on it, but I mean, she's making it better. So very, very excited. Now, in addition to Kyla, we have another me. So as you know, Tanya Myra is our new director. She took Diane Moore's place. And so that vacated one of the assistant director positions. And we were lucky enough to score Kevin Jackson. And so Kevin, I'm going to have you hop in and kind of introduce yourself, and he'll actually be supervising Kyla directly. So Kevin. Maybe it's going to unmute for Kevin. I'm not sure. Kevin, can you hear us or see us? I can see you. Oh, there you go. Oh, now you're gone. You were there for a moment. All right. Well, while Kevin's working with some technical difficulties there, Kevin will be kind of overseeing that continuum of services. So sort of the ongoing piece of what we do. You know, everything from the, you know, getting in the homes, working in the homes, you know, foster care if it's necessary. He's also going to be over our safe which is our, internal database. He's got a bunch of pieces that way. And so I, on the other hand, will kind of keep more of the beginnings of things. So think intake, prevention, the initial CPS investigations when we first kind of get in the door, training, that kind of thing. And I will actually, we have a new person will be coming in to supervise who has been a contract person who helps with procurement, along with our program administrators, who will continue to work on it. So we're going to kind of divide it up that way just a little bit. So you'll still see, we're going to tag team a lot of things. So you'll see Kyla and you'll see me and Kevin on a fairly regular basis, particularly at this meeting. We want to come in and sort of tag it. So, all right, let's just see, Kevin, let's see if it works for you. Are you able to will it let you talk now and introduce yourself? Does not look like it's working for him. Darn it. Okay. That's okay. Kevin, can you hear us? Thumbs up if you can hear us.
Oh, I have now joined.
Okay.
Oh no. Have I been sitting there in a 3-minute conversation and with a blank look on my face?
No worries at all. We were just kind of introducing you and a little bit as to kind of what your line of supervision and kind of the ongoing piece and that continuum of care. So yeah, I just wasn't sure if yours was working or not. So
Yeah, no, I apologize. I switched over to a panelist and lost all my audio. So my apologies. It is now back.
no worries.
Oh. And at a point of introductions or has
Yeah,
that occurred?
I was just kind
I
of
apologize.
telling him, oh, no, you're okay, not a problem. I was kind of telling him who you were. Kyla kind of introduced herself and that we're going to kind of tag team moving forward, since it kind of providers kind of are part of the whole system, the beginning, the middle, the end. But Kyla will be the main contact, and then followed by you and I.
Perfect. Sounds great.
Okay, that's all I had to offer.
Thank you, Sherry. I appreciate that. We'll go ahead and turn it over to Reg.
Hello, everybody. Glad to be here today on to finally have some sunshine and warmth. Feels good. And I'm filling in for April and Rachel, who are both out of the office today. And so not a whole lot to share. I did want to let folks know that the family-based contract, some awards have been sent out on that, and that is an ongoing contract is open. And so if there's other folks who want to apply for it, we're always open to having more people provide services. And other than that, they should be back here. Rachel will be back, I think, tomorrow, and we'll give another week before April is able to rejoin us again. That's just the quick update from JJYS.
Thanks, Reg. I appreciate that. All right, we'll go ahead and turn it over to Chanel.
Hi, I'm here with the Substance Use and Mental Health Office, and just a couple of updates for everybody. So our suicide prevention, I talked in the last quarterly meeting that we have the Live On campaign and the Live On playbook that's been available to everybody. They're expanding even further. They've got a new Live On license plate that is available to our citizens in the state of Utah. So the first 500 applicants, the fees will actually be waived for that license plate. We're hoping to promote it across the state of Utah and build some awareness. So if you're interested in receiving that Live On license plate, we do have a fillable PDF form that we'll put in the chat box that you can link to. You just fill out the application and submit it, and then we can go ahead and get your application reviewed and approved. We have to have 500 applications approved before they'll start making the license plates for us. So we're hoping to get that shortly so that we can start the production of those. Beyond the 500 applications, there will be a fee for anybody that is after the 500. And then the fee waiver is just for the first year. So every time you need to do your license plate and stuff renewal, you'll have to pay for the registration and stuff after that. But we'll make sure the PDF is in the chat. So please make sure you share that with coworkers, with family, with other providers and so forth. We'd really like to spread the word on that. We also have our 22nd annual Generations Conference that's taking place May 22nd and 23rd. Registration is open for that. We'll put the registration link in the chat as well for anybody that's interested in attending that conference. And then we also have another registration available coming up for the 7th annual Addictions Update Conference that's hosted by the University of Utah on science, policy, and treatment. And it will be held June 12th and the 13th. Registration is also open for that, and we'll put the registration link in the chat box as well for anybody that's interested in attending that conference and receiving some training. CEUs are available for both those conferences if there's anybody that needs CEUs. So please share those with other coworkers and individuals that may need to get their CEUs and be attending the conferences. And that's all we have for today.
Thank you so much, Chanel. Go ahead and now turn it over to DSPD. I believe that's Jamie.
Thank you. Let's see. Sorry, let me get this in front of me. Okay, so Medicaid's in the process of replacing MMIS with PRISM, and this is going to impact the emergency payment process. It involves two parts. The first part became available April 14th. The PCSP will remain editable for 1 month after its effective end date. During that period, the support coordinator can make changes to the plan that are compliant with the existing policies and validation requirements. And then the second part of this change is going to be implemented in the later part of May. If the provider submits a payment that fails the validation process after the closed PCSP's period expires, the support coordinator can submit a request to DSPD that will temporarily reopen it. The RFS process will be used to submit these requests, meaning RFS will be remodeled to accommodate this. And that training will be for support coordinators in May. The Institute for Disability Research Policy and Practice is doing a survey about sexuality relationships in people with disabilities. They're hoping for responses from adults with disabilities, family members, or service providers. So we can put a link to the survey in the chat if you're interested in taking it or sharing it with other people. And then the last thing is we have our quarterly housing meeting, which is Thursday, the 27th. Providers are welcome to attend these meetings, and the purpose of the meetings are to better understand ways to support people with housing options in the community, as well as coordinate and address service gaps. If you're interested in attending these meetings, but you're not receiving notifications, you can reach out to Camille Bowen or Mandy, and we'll put both of their names in the chat. And that's all I've got.
Thank you, Jamie. We will go ahead and just so everyone is aware, if they have any questions, Joseph with Medicaid Long-Term Supports and Services is on today as well. I think he's a little overwhelmed working with the PRISM thing. So the PRISM launches his update today, I believe. So we'll go ahead and turn that over to the Division of Licensing and Background Checks. And I believe, Carmen, we're kicking that to you first.
Thanks, Amanda. Hi, everyone. I'm Carmen Richens with the Division of Licensing and Background Checks. I know we all love this warm weather. Winter was really long, but a couple of weeks ago, we sent out a notification regarding making sure that your agencies are prepared for flood. The last few days have proved we're definitely going to need to be aware of this. wanted you all to have access to that document. Some key things that I found important as being a provider in the past was also making sure that your employees are prepared for flood at home, because they need to be prepared enough that if it's flooding at home, they can still come to work and work for you. So this document, Joe, if you'll put the link in there, covers a lot of things. There's a floodplain zone where you can look and see if you're in the floodplain. And I've heard a lot of people this past week have been looking at that and found that their buildings or their homes are in the floodplain. And that gives you some things you can do to get prepared. And there's some other links on that document that you're welcome to use. Hopefully can assist everybody be prepared and keep us safe as we move forward through the next few weeks and dealing with the water that's going to come from the amazing snow we've had. So again, I'm grateful for the weather, but it definitely is going to have its impact on all of us. So, and I would like to turn a few minutes over to Simone so that he can talk about some training that he's going to be offering for providers.
Thank you, Carmen. Good afternoon. So tomorrow at 10 a.m. and then at 4 p.m., we will be conducting another set of trainings on the process the Office of Licensing is implementing to regulate compliance. It is important for not only the owners, but also employees to know how the process works. This will be the number 5 and 6 of this series of trainings. We will do it again before July 1st when some other pieces of this process will be implemented. So it is important for you to be able to participate on these trainings. Again, our trainings are tomorrow at 10 a.m. and at 4 p.m. Same training in the morning as in the afternoon. The link to the training is on our website. And so you can go to our website and see the link to our training. Thank you.
Thanks, Simone. Amanda, I think that's all we have from our division.
Perfect. Thank you, Carmen and Simone. All right, I will go ahead and turn it over to Nathan Cruz.
Hello, everyone. I've just got one bit of information for to share. We are hosting a provider fair in the Southwest region. Looking forward to having you come down, introduce yourself, talk about the services you provide, meet and greet with caseworkers. Even though we're in the age of virtual connectivity, sometimes that face-to-face connection can be really important in terms of finding the right placement and services for the children, youth, and families that we work with. So we will be holding this in Cedar City, April 20th from 10 a.m. to 1 o'clock p.m. at the Heritage Center Theater in Cedar City, 105 North, 100 East. We'd love to see you there. If you want to see all 4 seasons in one day, start in the Cottonwood Canyons, drive down to St. George, and you'll see winter, spring, summer, maybe not fall, but yeah, we'd love to have you there, meet with you, talk to you, tell us about all the great things that you do for the clients we serve, and meet with the caseworkers who are on the front line, who have a really good understanding of what their clients' needs are, and are really remarkable individuals that we're all trying to make lives better. So we'd love to see you there. Show up, and you'll see my smiling face there, and I'd love to meet you as well. So that's everything I've got. Thank you.
Thank you, Nathan. All right, Joe, I'm going to turn it over to you.
Hey, greetings, everyone. I'm Joe Doherty. I'm the Director of Communications here at Department of Health and Human Services. Cannot believe that it has almost been a year now since I've been here. So we wanted to share with you something that's been really important to us that we really caught on to during the pandemic, was just how important it is for us to be communicating to as many people as possible in the languages that they speak. And as many of you probably are aware, the second most popular, second most commonly spoken language in Utah is Spanish. And so we've been wanting to do this for a long time, have an official presence on social media in Spanish. And so we've launched our social media accounts on Twitter, Instagram, and Facebook. Are now available in Spanish. And I just dropped the link in there. Well, not the link, just the handle. So if on any of your favorite networks, Twitter, Facebook, or Instagram, you can find DHHS de Utah. as our Spanish language accounts. And we are going to do our best to make sure that we're being equitable in the way that we communicate in English and in Spanish. And then, of course, we do have plans for if in some major incident like the pandemic response, we do have the ability to ramp up our translation capabilities to about 32 languages total. That includes languages that I had never heard of before the pandemic, including Karen, Kinyarwanda, a bunch of these Marshallese, and languages that are spoken by a refugee community as well as American Sign Language. So we have a firm belief in the importance of equitable communications, especially in a crisis. But right now we're doing English and Spanish because that's all we can handle on a daily basis right now. That's just the sheer amount of information that we can put out as a department is a lot. But we just wanted to make sure that we're doing the best that we can. And this is our next step forward. So we hope that you'll follow us. If you are Spanish speakers or clients are Spanish speakers, please feel free to share that with them, because we're sharing information about public health and what we do and how we do business here, and hopefully some information that will help them in their lives. So thank you.
Thank you, Joe. Appreciate that. Now, exciting. We're going to turn this over to Mark next. It seems like it was a year ago, but it really only has been a month since the legislative session ended, and there was a lot of happenings in that 45 days, and we haven't had this group together. So Mark's going to run through some of the highlights. I don't think he's going to run through all the hundreds of bills that affected our department, but some of the highlights. So I will turn it over to you, Mark.
Thanks, Amanda. And yeah, it's funny how the legislative session feels like it drags on forever. And then you get done with it and it's just a sigh of relief. And now we're just going to rip that Band-Aid right off for everyone and reintroduce you back into the legislative session stuff. I'll try and make it as pain-free as possible. The first thing that we want to touch on was the recodification bills. So this was Senate Bills 38 through 41, or the big ones. And what they've done is with the merger between DHS and DOH, they are now merging our sections of code. And so 26 and 62A are now becoming 26B. And what I'm going to do is I'm going to post a link in the chat for everyone. This is a draft copy of kind of how that reshuffling is all going to settle out. This is from the Legislative Research and General Counsel, so legislative staff. But this will help you to understand when everything is finalized and put online, where those sections of code that you're most interested in are most likely going to be found. This is still a draft with all the bills that were passed. There's still some moving parts. They explained to me that it was like fresh concrete. So maybe not going to move that much, but they still need a little bit of wiggle room in case they needed it. So hopefully all of you will find that to be helpful as you're trying to find your specific sections of code. We want to touch on a few different bills and also new funding items that the department was a part of and that the legislature ultimately passed. So we had DCFS and JJYS provider continuum, Medicaid parity. The legislature allocated just over $1.5 million of ongoing funding for that. They also had another one-time for grants for adoption for hard to place kids of $640,000. Home visitation services for more families received an ongoing of $988,000, so almost $1 million, and a one-time infusion of 4.7. And if I remember this one correctly, I think this was part of that $15 million package that the legislature, that the governor had advocated for. And so I think the plan is that there were a few different funding streams for that, but it was going to be 15 years over a 3-year timeline. We also have increased intermediate care facility Medicaid payment rates ongoing of just over 1.2 million. Mandated additional needs and youth aging out of DCFS and JJYS, nearly 7 million and ongoing for that. I'm trying to think of the ones that all of you are going to find most pertinent, but there's such a broad spectrum here. I don't want to skip over any unintentionally. But we have providing Medicaid annual well care visits that received ongoing funding for just over 200,000. HB 290, there's a Medicaid waiver for medically complex children amendments. So obviously we will have to go through the process of getting that waiver approved as a department through CMS, but there's almost $1 million in ongoing funding that's being put towards that. Services for people with disabilities, so addressing the waiting list. This one received an ongoing appropriation of just over 3.5 million. So something that I know that we and a lot of others are very excited to see get additional funding. There's a community mental health Medicaid rate increase, ongoing funding of $3 million. HCBS waiver rate increase. That one is receiving ongoing funding of just over $600,000. We've also got a new choices waiver rate increase for nearly $2 million and ongoing. And I'm almost done, I promise. A nursing home rate add-on for wages is receiving nearly $5 million in ongoing funding. Then we've got quality improvement incentive program for ICFs for the intellectually disabled. So the ICFID. That one received almost 330,000 in ongoing funding. And then they've got a waiting list respite care. I believe this was Representative Ward who was influential with this one. That's receiving a one-time funding of $3 million. And then youth provider inflationary cost program or cost adjustment. We've got almost 1.5 million ongoing. Sorry, ran through those pretty quick. If you have questions, please let us know. We've got our subject matter experts from the department on with us today who might be able to better help you understand how those funds might be rolled out and a timeline on those. Just a few bills that I'll touch on. One was SB 198, which created 2 different accounts for the department. One is for the fees to be placed into so that we can use those for upgrades and maintenance of licensing databases, and also really trying to help improve the program itself. And then the second one was DSPD, Expendable Special Revenue Fund. Okay, it's a mouthful, but essentially what that one is trying to create a rainy day fund so that if there are funds that are left over at the end of the year, instead of lapsing or going back to the legislature to spend, willy-nilly, those unspent funds will actually be captured in this special fund for a rainy day. So if there's a downturn in the economy, we're able to use those funds to ensure that services are able to continue for those individuals. And then the last bill that I'll probably touch on, because I'm sure you're already tired of hearing from me, is SB 204. And this was Senator Bramble's autism coverage amendments. So this one, if I remember correctly, there's no cap on the age of individuals who would be able to, be available for these funds. And then I believe that coverage amendments is coming in at just over 3 million ongoing funds. So a lot that happened over the past 3-4 months with the legislative session, and a lot that will continue to happen as our department, received new marching orders from the legislature on things that they want us to start doing differently or to do new things. And so that's what we'll be working on as a department over the upcoming months, is making sure that we've got everything in place so that we're in compliance with state statute. So happy to help answer any questions that you all have on any of those funding items or any bills that may or may not have touched on, but appreciate you having me on the call for this time. So thanks.
Thank you, Mark. And that was a brief overview of a lot of information. So thank you very much. So we are going to just go ahead and go to the question and answer section of this call. Just to remind you all, feel free to drop any questions you have in the question and answer section. They do not have to be related to our updates today. If there's something you have a question for any of our operating units on the call, feel free to drop those in there. So I'm going to just go ahead and go back to Shannon. 2 questions that are semi-related here. One is asking if you could share the checklist for the settings that you referred, and then also where are they able to retrieve that template you were talking about earlier. So if you could provide that information, that would be great.
Absolutely. Thanks, Amanda. So the settings checklist are found at our website at dhhs.utah.gov. I'm dropping it in the chat, so you can just go from there. Right now, the only tools that are posted are the settings compliance checklist, but we are prioritizing adding additional tools and templates in the next couple of months. I am happy to drop the link to those checklists in the chat, but it is a download link, so it may be more useful for you just to go to the website, scroll all the way down. There is a section called Provider Tools, and both of those checklists are linked from there. And I will go ahead and drop those specific links in the chat as well.
Thank you, Shannon. And the next question, I believe, is for DCFS. Says, I am interested in finding out when the contract DHHS 90758 is going to be available for renewal. And if you could also maybe, just for those of us that don't know the number contracts, let us know which contract that is. That would be great.
So I have to laugh, and this dates me, but when I hear referred to as the 90758, I'm like, okay, where's our 90210? Like, where? Anyway, some of you will get that, some of you will not. Okay, first off, let me say this too. I fear I may have confused you when I introduced the 2 new folks. You guys just have one face that you really will be sort of your contact, which is Kyla, moving forward. So Kevin and I will be there to help. We'll be there, as needed, but you guys can just, so you don't have to say, oh gosh, this seems like it's early on in the process. Let's contact Sherry. This is a little later. Maybe it's Kevin, or is it Kyla? Just Kyla can be your face. So I'm going to put her on the spot here for a second. I can tell you that we were kind of waiting on the legislative funding to make the rate adjustments. And so the language is being finalized now, and then it's going to go for legal review. And then we're hoping to have it posted in a few weeks. But Kyla, did you want to add anything, or at least to tell them what the real title is?
Yeah, so 90758 is the ABL procurement for RAP services. It's also affectionately known as CETW, or the Community Evaluation Treatments and RAPs contract. So it is primarily, it's actually across multiple of these OUs. I just get to be the face of making sure that it gets out for you all. But a lot of great work from Nathan Cruz and Jamie and lots of people on this call to make sure that that's going to be ready for us here again in a couple of weeks. We're just finalizing some final outcomes language and making sure that we get the rate table adjusted from the legislative session. And stay tuned. You'll get an email from Kainoa Willing the second it is available.
All right, thank you so much, Kyla. All right, I am going to go ahead and let's see what the next question we have here. Jamie, I'm going to kind of put you on the spot, and I don't know if it'll be Jamie or Joe that would be the best to talk about. But could we please address Appendix K or caregiver compensation?
Yeah, sorry, I was just checking to see if we had sent anything out already about caregiver compensation that I could share. So I can talk about, let's see. You know, it might be something that I'm going to need to follow up on it afterwards. I don't want to say anything I'm not supposed to say right now. And if nothing's gone out about it, then I prefer to get more information before I share it with this group.
Perfect. Thank you, Jamie. And just to reflect on that, I assume any changes or notifications that providers would need to know, DSPD would be sending out an email to them. Is that correct?
Yes.
Perfect. Thank you. All right. I am going to throw this question out, and it is addressed to Mark, but I'm going to ask maybe Mark's subject matter expert friends, such as Joseph, can help him answer this. Can you please elaborate on the $600,000 for the home and community-based services?
Yeah, happy to take that one on your behalf, Mark. But this was primarily to support some rate increases for the Aging Waiver, New Choices Waiver Program, and our EPASS program that assists disabled individuals with employment-related personal assistance services. It's intended to improve some of the personal care and home health rates in those programs.
Thank you, Joseph. Appreciate that. All right. Next question. I'm going to throw this to you, Simone, and if that's incorrect, you can call a friend. When will the COVID-19 changes discussed in our last meeting be reflected on the DHHS website, i.e. no longer needing to do the Google form when we have positive cases? Since last meeting, I told this was going to be disabled, but I see that it is still fillable.
Thank you, Amanda. The form is no longer available on our website for reporting COVID-19 cases. So it is not the DHHS website. It is the Division of Licensing and Background Checks website. And the form is no longer there. And even if you are accessing an old link that has the form, you're not required to submit that form anymore to us. You still need to discuss outbreaks of COVID-19 and any other communicable diseases with your local health department, but you are not required to complete the COVID-19 form. You're not required to submit that any longer. It is not available on our website. If you see it there, let me know. It is not supposed to be there, but sometimes things don't work that fast.
Thank you so much, Simone. And I know we've been updating a lot of our websites right now, so that, like Simone said, if for some reason there's a link out there somewhere that we're not aware of, definitely let us know and we'll get it taken care of. So I'm going to throw this question to Shannon. Is the site visit tool the same as the settings checklist?
Yes.
All right, that was an easy question. And then just as we're wrapping up, I know that we have just a little bit longer, and just one quick question that is on here. I'm going to put Joe on the spot. Someone is asking if there's a way for you to enable chats or copy the text so they're able to have that at the end.
Yeah, thanks,
just
Amanda.
share how we can share that.
Yeah, thanks. And I just wrote back to that person as well. For some reason, I'm having a problem like copying links out of Zoom and putting them somewhere else. So what we can do is in our follow-up email that we send after the call, that will include the recording of the phone call. We'll just include all of the links that were part of today's meeting. as well. So I would just say for our panels, if you can make sure those links that you shared are back in our agenda document. I think the ones that Shannon shared and Mark as well, if you can throw those in our document, then we'll make sure that those are easily copied into the follow-up email. And that should come to you this week, hopefully in the next couple of days.
Perfect. Thank you, Joe.
Oh.
And it looks like, unless I'm missing something, that is the rest of our questions. Oh, of course, there's a question that always pops up when we start ending. Shannon, I believe this is a question for you as well, because it looks like it's a follow-up to the other question. Or maybe it's for Joe, as well as the text and explanations.
Yeah, Eliza, for sure. We'll do our best to make sure that so you know what those links are going to. Yeah.
Yes, thank you. Yeah, we can put at least a sentence so you know what link it's for. All right. Thank you so much. Well, thank you all for coming and listening today. Hopefully this information was helpful. We will be having this meeting next quarter, and I apologize, I've lost what date it is. We will send that in the email follow-up. As always, feel free to reach out to any of the members on this panel or other DHHS employees. We're always happy to answer your questions and follow up with you in between the quarterly meetings. Please don't wait for this meeting to ask your questions. You can also email any questions at the CQI email, which has been dropped in here, and we'll ensure that's in the follow-up email. Thank you all very much for all you do to serve Utahns. We know that sometimes this is it's a hard job, and it's been a rough few years that people have managed through COVID, and I keep thinking, maybe we're up on the upswing. And so I really just want to thank you all for all you do to serve the children, youth, and families in Utah. And so thank you very much. We'll see you all next quarter.